Okay, so we have the small intestine tubes here. So essentially there's this kind of thicker base layer here where it's a more of like a sheet type of tissue, and then we've got all of the tubes that sit here. And so we've got Betty here, and this, what we call the mesenteric root here, this sheet area, sits at a diagonal angle here right on top of the major blood vessels of the abdomen, so the abdominal aorta, the common iliac vessels. And so there's this placement here where it just lands right in front of the spine. And so when we're looking at how, if there's tension, oftentimes there's tension in this mesenteric root, we can have issues with the blood flow to the pelvis, to the legs. We can have issues with the spine. We have the hip flexor muscles that run on both sides. And so people can have hip tightness, back pain. This mesenteric root for a lot of people is really restricted. And so it's another area, kind of like the liver that we've talked about in the past, where we tend to work on almost everybody. And so what's really interesting when we look at this mesenteric root here sitting with all of these tubes, you can have tension where we're kind of working along the spine, adding in some leg movements. You can also have tension from this root here to one of these tubes. And so sometimes we have to stretch the root with one of the small intestine tubes. And then sometimes we have to work in between the intestinal tubes and the covering around the abdominal organs, the peritoneum. Sometimes that can be kind of adhered to one of the tubes as well. So there's a lot of different areas within the small intestine tubes that we want to be moving for health and movement of the surrounding joints, blood vessels, nerves, but also for the ability for the small intestines to do what it needs to do, so absorbing nutrients. So if we have within this mesenteric root, there's also a branch from the abdominal aorta that innervates and comes into, not innervates, but the blood flow that comes into the mesenteric root that provides blood flow to the intestines. And so we need blood flow to move and also to absorb those nutrients. So that's a big reason we want this area moving. Another big thing and common thing that we see is, so we have this peritoneum, this, if you want to think of like saran wrap covering this area. It is a layer of tissue that comes around the abdomen and then folds into kind of the back side of the abdomen, right by near the spine. And so we have some organs that are behind that saran wrap layer. So the kidneys will be behind it, but the small intestines are in front of it. But that layer that peritoneum layer is a continuation of the abdominal muscles. And so when we look at someone with diastasis recti, so that widening of the linea alba, the tissue between our six-pack muscle here, a lot of times women will have trouble recovering from that. So it's a natural progression when someone is pregnant and the fetus is growing. But a lot of times when they're postpartum, that area doesn't come back together completely. And there's some really cool research about working the tubes and working this mesenteric root and helping to resolve that diastasis recti. So shortening it all the way back to where it was before, or just making it smaller so it's a little bit easier to control with the core. So that's a really cool visual, just to see how all of this is so intertwined, and that we have to look, again, when there's an issue like a diastasis where it looks more muscular, but what's underneath that potentially causing that pressure pushing up against the abdomen and not allowing it to resolve the way that we want it to.